Alrighty, so I'm going to be talking about opioid use in America. So the CDC puts out information each year about fatal and non-fatal opioid overdoses in the US, and they categorize it into different types of opioids, including natural opioids, semi-synthetic opioids, methadone, synthetic opioids, and heroin. And this information is very helpful for us because we can differentiate between which opioids are prescribed at the hospital and causing death and which ones are not, like heroin. So for patient-centered strategies, pain contracts are used to help both physicians and patients. It's a signed form between physicians and patients. And it basically guarantees that the patient will follow these guidelines and that they will be prescribed their pain medications. And this is patient-centered because the patient is aware of the plan and what is going on, and the patient knows where their next dose of opioids will come from. And then a medication reconciliation is always a great idea and is very patient-centered as well. We can ask questions like, what opioids is the patient taking? How is their pain doing right now? And what medications could we substitute instead of opioids? And this picture is just an example of a medication list for patients that we should be doing with every single patient when they get to the hospital. This is an example of a pain contract. You can see on the left-hand side that the patient agrees to all of the statements, that they will keep their appointments with their primary care doctor or their pain. A lot of times these patients go to the pain clinic, so they'll keep their appointments with their pain clinic doctor, that they'll participate in non-pharmacological treatment, that they'll keep their medication safe and make sure that it isn't stolen, that they will take their medication as instructed and not change the way that they take it, that they won't call between appointments or go to the ER to try and get pain medications, that they make sure that they have an appointment for those refill appointments, and that they will treat the staff in the office respectfully at all times, that they won't sell their medication, and so forth. Pain contracts are definitely a big part of interdisciplinary teams because everyone on the team has to be involved. As an example, I had a patient come to the ER and the doctor went and saw the patient. The doctor came out of the room. The doctor looked at the patient's chart and realized that the patient is on a pain contract from a different hospital in the same organization, but just a different hospital on the other side of the valley. So we had to tell that patient, I'm sorry, we can't prescribe you. We can't give you any opioids in the ER today because they have that pain contract. And we wouldn't have known unless it was in the patient's chart. So it's really important that everybody on the team is involved. Nurses should also be aware of pain contracts so that they don't make false promises to the patient about being able to get them pain meds. And the patient is a big part of the team, and they are more involved in their care when they have a pain contract. For ethics and legality, the patient signs the pain contract, which makes it a legally binding document. And they usually will sign the pain contract because it ensures that they will get their prescriptions. And if they don't sign the pain contract, then they don't know where their next pain pill prescription will come from, and they'll have to go to the ER or other clinics to try and get pain medications. And the ethics are pretty clear because of the contract, and these contracts are usually abided by. There is a big potential impact of using pain contracts and decreasing opioid use in America. The results are already being seen in hospitals. Like I said with my example, we didn't prescribe pain medications to that patient that day. Patients and physicians are more at ease because, like I said, patients know where their next pain prescription is coming from. And physicians aren't as scared to prescribe opioids because they know exactly how many opioids the patients are on at a time. And lastly, the potential impact is that these pain contracts and decreasing opioid use overall saves lives. 128 people in the U.S. die every day from opioid overdose. And these are just some signs of opioid overdose that everybody should be aware of. And those are my references.